Did you know that a brief dizzy spell today could be your brain or heart's final warning before a life-altering catastrophe? According to the American Heart Association, nearly 1 in 5 people will suffer a major stroke within just 48 hours after experiencing a so-called mini-stroke, and most won't even know it happened. At the same time, experts at Mayo Clinic warn that more than 45% of heart attacks, especially in women, occur without the classic chest pain. These are called silent heart attacks, and they are among the deadliest. Have you ever felt your heart suddenly race without a clear reason? Numbness on one side of your body that quickly goes away, or a wave of exhaustion that just doesn't make sense? Don't brush it off as just getting older or lack of sleep. These could be early symptoms of heart attack or stroke, warning signs that your body is in serious distress. The terrifying truth is, you only have minutes to recognize these signs, but millions miss them every single year. So, what can cause a heart attack? What are the symptoms of stroke and silent heart attacks? How can you tell the difference between aging and a medical emergency? In this video, you'll discover the 7 silent symptoms of heart attacks and strokes that are often ignored and how to catch them in time. Science-backed ways to prevent heart disease and stroke through lifestyle, nutrition, and awareness. Real-life stories and proven strategies that could save your life or the life of someone you love. Stay with us until the end because you may not get a second warning.
His name was George. At 72, he was sharp, independent, and still drove himself to his favorite fishing spot every weekend. But one quiet Tuesday morning, something felt off. As he tried to explain the weather forecast to his wife, his words became jumbled. He stared blankly for a moment, then snapped back as if nothing had happened. "Just a senior moment," he laughed. 2 days later, George suffered a massive stroke that left him paralyzed on his right side. What George experienced was not just forgetfulness. It was one of the minor stroke symptoms, a transient ischemic attack, a medical emergency that often masquerades as fatigue, confusion, or dizziness. According to the Centers for Disease Control and Prevention, CDC, over 240,000 Americans experience a TI each year, and nearly half of them never seek medical help because the symptoms vanish quickly. These brief episodes, often dismissed as aging, are especially dangerous for women. Female stroke symptoms may appear as sudden fatigue, anxiety, or disorientation, not the classic signs we've been taught to expect. That's why signs of a mini-stroke in a woman are among the most overlooked, yet they can double the risk of a full-blown stroke within just days. American Stroke Association 2021. And when it comes to heart disease, the story is strikingly similar. Heart attack women's symptoms are often silent: shortness of breath, jaw pain, nausea, and misunderstood even by healthcare professionals. George's story is not rare. In fact, it may sound familiar because it might be your spouse, your neighbor, or even you. So how can we tell the difference between a harmless episode and a life-altering warning? That's what we'll uncover next, with 7 powerful signs that could save your life. We often think that serious heart problems or strokes announce themselves loudly, with crushing chest pain or complete paralysis. But in reality, the body whispers first. And too many times, we ignore those whispers until it's too late. Let's walk through 7 early warning signs, subtle, often dismissed, that could appear days or even weeks before a heart attack or stroke. Knowing them can change the course of your life. 1. Unusual fatigue. Not just tired after a long day, but a deep, unexplained exhaustion that lingers for more than 48 hours. According to a study in Circulation 2020, over 70% of women reported fatigue in the weeks before a heart attack, and most never connected it to heart disease. This kind of tiredness isn't relieved by rest. It's your heart struggling to deliver enough oxygen. 2. Sudden dizziness or balance issues. This isn't from standing up too fast. It's a spinning, unstable feeling that can signal a minor stroke symptom, especially dangerous if paired with visual disturbances or slurred speech. The CDC reports that nearly 1/3 of older adults who experienced sudden balance loss later suffered a stroke within the following 3 months. 3. Severe, unexplained headache. Called the thunderclap headache, it often hits fast and with no warning. It may be the brain's cry for help, a classic stroke symptoms fast indicator. If it feels like the worst headache of your life and nothing seems to relieve it, don't wait. 4. Numbness or weakness on one side of the body. If your arm, leg, or face suddenly feels weak or tingly, especially on just one side, act immediately. Ask yourself, can I smile evenly? Can I raise both arms? If not, you may be experiencing face stroke symptoms, and every second counts. 5. Sudden vision changes. Blurred or dimmed sight in one eye, a curtain falling over your vision, these may last only minutes, but are hallmark signs of a mini-stroke. According to Johns Hopkins Medicine, about 20% of stroke survivors recall a sudden change in vision as their only early warning. 6. Slurred speech or confusion. You may know exactly what you want to say, but can't form the words, or suddenly struggle to understand others. These are often overlooked symptoms of heart attack for women, where cognitive changes may appear before any physical pain. 7. Chest discomfort that radiates. For men especially, classic heart attack symptoms include pressure or pain in the chest that spreads to the arm, jaw, or back. But sometimes it's mild or mistaken for indigestion. Yet even this small signal can precede a major cardiac event. These aren't just symptoms. They're your body's final alert system, and recognizing them may be the single most important act of self-care you ever take. Because now you're not just informed, you're empowered. Next, let's understand how these signs relate and how to tell the difference between a stroke, a mini-stroke, and a silent heart attack before it's too late.
You've just discovered how your body sends quiet warnings before a crisis. Now it's time to understand exactly what those warnings might be pointing to. Many people confuse the terms heart attack, stroke, and mini-stroke, yet they are 3 very different emergencies. Knowing how to tell them apart is not just useful, it can save your life. A heart attack, medically called a myocardial infarction, happens when the blood flow to part of the heart muscle is blocked, often by a clot. This leads to tissue damage and, if untreated, permanent loss of heart function. Common signs include chest discomfort, shortness of breath, cold sweat, and pain radiating to the arm, jaw, or back. But not all heart attacks are dramatic. According to a study in the Journal of the American Medical Association, nearly 45% of heart attacks are silent, especially in older adults and women. These symptoms are vague, such as fatigue, nausea, or lightheadedness, yet just as dangerous. That's why understanding the symptoms of silent heart attack is so important. Stroke is a brain attack. It occurs when the blood supply to part of the brain is interrupted or reduced. This deprives brain tissue of oxygen and nutrients, causing brain cells to die within minutes. The signs are sudden and severe: trouble speaking, numbness on one side of the body, confusion, or difficulty seeing. These are the classic signs and symptoms of stroke, and they require urgent medical attention. A mini-stroke, or transient ischemic attack, may seem less threatening because its symptoms disappear within 24 hours. But this temporary improvement is dangerously deceptive. Studies from the American Stroke Association show that 1 in 5 people who experience a TIA will have a major stroke within 90 days, and nearly half of those will happen in the first 48 hours. These mini-strokes are the body's warning lights, urging you to act before permanent damage occurs. When you can recognize the difference between these 3 conditions, you give yourself and your loved ones the power to respond quickly, seek the right help, and most importantly, prevent a second chance from never arriving. Now that you understand the differences between heart attack, stroke, and mini-stroke, the next question is, what should you do if it happens to you or someone you love? Timing is everything. According to the American Heart Association, up to 80% of strokes could be prevented or minimized with early intervention.
Recognizing the warning signs of stroke and acting immediately can be the difference between full recovery and lifelong disability. One of the most reliable tools for early stroke detection is the FAST test. FAST stands for face, arms, speech, and time. First, look at the person's face. Ask them to smile. If one side droops, it's a red flag. Next, have them raise both arms. If one arm drifts downward or cannot be lifted, that's another warning. Listen closely to their speech. Are the words slurred, jumbled, or hard to understand? If any of these signs appear, it's time to call emergency services without delay. Every second matters, as brain cells begin dying within minutes of a stroke. But recognition is just the first step. Keeping a symptom diary can provide crucial information to your doctor. Write down the date, time, and description of what you or your loved one experienced. Was it fatigue, numbness, a moment of confusion, or a brief loss of vision? These small details can guide your medical team toward a faster and more accurate diagnosis. And when speaking with your doctor, be specific and honest. Don't minimize your symptoms out of fear or embarrassment. Ask directly, could this be a sign of a stroke or heart issue? Mention your family history. According to Mayo Clinic, being proactive in conversations with your physician leads to earlier diagnosis and better outcomes. Preparedness isn't panic, it's protection. The more confidently you recognize the signs and symptoms of heart attack and stroke, the more power you have to act when it matters most. After recognizing the signs and knowing how to act in an emergency, the next step is perhaps the most powerful of all: prevention. For those over 60, heart attack and stroke risks rise sharply, but that doesn't mean they're inevitable. In fact, the National Institute on Aging confirms that most cardiovascular events in seniors can be prevented with lifestyle changes and routine monitoring. So, how do you prevent heart attack, prevent stroke, and protect your heart health for years to come? First, control your blood pressure. High blood pressure is the #1 risk factor for both heart disease and stroke. According to the CDC, nearly 70% of adults over age 65 in the U.S. have hypertension. Keep your blood pressure under 130/80 through a heart-healthy diet, regular exercise, and prescribed medication when needed. Second, manage stress intentionally. Chronic stress can disrupt your heart rhythm, increase inflammation, and raise your risk of blood clots. Mindfulness practices like meditation, breathing exercises, or even daily quiet walks have been proven to reduce cortisol levels and stabilize heart rate. Harvard Health reports that seniors who engage in stress reduction activities at least 3 times a week have a 24% lower risk of heart events. Third, stay away from smoking and limit alcohol. The American Heart Association notes that quitting smoking at any age significantly reduces the risk of heart attack within just 1 year. Excessive alcohol, on the other hand, raises blood pressure and weakens heart muscles, especially in older adults. Fourth, commit to walking. A brisk 30-minute walk each day boosts circulation, lowers cholesterol, and helps control blood sugar. Walking is also linked to reduced risk of falls and cognitive decline, according to research published in Neurology Journal. Fifth, prioritize sleep. Poor sleep and undiagnosed sleep apnea significantly increase the risk of stroke and heart failure. Seniors should aim for 7 to 8 hours of quality sleep and speak with their doctor about sleep studies if loud snoring or daytime fatigue is present. Lastly, schedule routine screenings. Regular checks for cholesterol, blood pressure, and heart function help detect silent issues before they turn dangerous. The American College of Cardiology recommends annual screenings after age 60, especially for those with a family history. Preventing heart disease and stroke isn't about perfection, it's about awareness and consistent action. With these 6 golden habits, you don't just add years to life, you add life to your years. Once healthy habits are in place, there's one more key to protecting your heart and brain: what's on your plate. Your blood vessels, your energy, even your memory are deeply influenced by what you eat. For seniors, choosing the right foods isn't just about managing weight, it's about nourishing the heart and preserving quality of life. The best diet for heart disease and stroke prevention is built on simple, whole ingredients that work like medicine in your body. Berries, especially blueberries and strawberries, are rich in anthocyanins, potent antioxidants that reduce inflammation and oxidative stress. A Harvard study tracking over 90,000 women found that those who consumed berries at least once per week had a 34% lower risk of heart attack. Just half a cup a day can make a difference. Fatty fish like salmon, sardines, and mackerel are high in omega-3 fatty acids, which help lower triglycerides, reduce blood pressure, and prevent clotting. The American Heart Association recommends eating 2 servings per week. For older adults with congestive heart failure, this kind of diet for heart health improves not just survival, but overall function. Leafy greens such as spinach, kale, and Swiss chard are powerful brain and blood vessel protectors. They're high in folate and vitamin K, which help reduce levels of homocysteine, an amino acid linked to stroke risk. Just 1 cup of cooked greens daily supports vascular flexibility and cognitive clarity. Other heart-boosting staples include beets, walnuts, oats, and extra virgin olive oil. Beets enhance nitric oxide levels, helping relax blood vessels. Walnuts offer plant-based omega-3s. Oats provide soluble fiber to lower LDL cholesterol. And olive oil, when used in place of saturated fats, supports healthy cholesterol balance. An easy daily plan: 1 full cup of vegetables, 1 handful of nuts or seeds, 2 servings of fish per week, and 2 tablespoons of olive oil as dressing or cooking fat. These simple adjustments, rooted in science, create a diet for congestive heart failure and stroke prevention that is accessible, affordable, and incredibly effective. This isn't a restriction, it's a gift, a way to feed your heart while still enjoying every bite. Because what you eat today shapes how you move, think, and live tomorrow. Because heart disease doesn't arrive overnight, and neither does health. But with every choice, from what you eat to how you supplement, you're building strength 1 heartbeat at a time. Finally, please remember that the information in this video is for educational and inspirational purposes. To get medical advice that is best suited for your individual health condition, especially if you have underlying medical issues or are taking medication, please always consult with your doctor or a qualified healthcare professional.